Sarcopenia, the silent killer of aging muscles. Hey everyone! Today we're going to talk about a common but often overlooked health problem, sarcopenia. Even if you haven't heard this word before, sarcopenia affects more people than you think, especially older adults. It's not just about feeling weak, it can seriously affect your ability to move, live independently, and in severe cases, it could even become life-threatening. The following information is for your reference. If someone in your family is suspected of suffering from sarcopenia, I suggest you seek a doctor you are familiar with for a detailed evaluation and treatment. 1. Why should we care about sarcopenia? Let's start simple. Sarcopenia is when your muscle mass and strength gradually decrease over time, especially as you age. It's more than just getting older. This condition is linked to some serious risks. According to the World Health Organization, WHO, and major geriatric societies around the world, sarcopenia is associated with a higher risk of falls, fractures, and hospitalization, reduced mobility and loss of independence, increased risk of dementia, depression, and even death from chronic diseases. Certain groups are more at risk, including people over 60 years old, those living with chronic conditions like diabetes, heart disease, or kidney disease, people who are bedridden or not physically active, anyone recovering from surgery or undergoing cancer treatment, individuals who are malnourished. The scariest part? You often can't see it happening. Someone can look fine from the outside, but actually be losing muscle at a dangerous rate. One day, they fall, fracture their hip, and may never get up again. The chain reaction from falls to immobility, to infections, and death is very real. 2. What exactly is sarcopenia? The term sarcopenia comes from Greek sarx, means flesh, and penia means loss. So literally, it means loss of flesh. Medically, it's defined as a progressive, whole-body loss of skeletal muscle mass, strength, or function. Not everyone develops sarcopenia just because they're getting older, but aging is the main risk factor. And here's the important part. The World Health Organization officially recognizes sarcopenia as a real diagnosable disease. 3. How is sarcopenia diagnosed? In 2022, the European Working Group on Sarcopenia in older people updated their guidelines. To diagnose sarcopenia, doctors look at three main things. 1. Muscle strength, usually tested by hand grip strength. 2. Muscle mass measured using a DXA or BIA machine. 3. Physical performance such as walking speed. Here are the common standards. Grip strength, all men, less than 27 kilograms, all women, less than 16 kilograms. This is considered low muscle strength. Gait speed, O, less than 0.8 meters per second suggests decreased physical function. O. Other tests like the timed up and go or 6-minute walk test may also be used. Muscle mass via DXA or BIA. O Asian cutoffs. Men, 7.05 kg. Men, women, 5.85 kg m quadrat. Doctors often classify sarcopenia into 3 stages. Probable sarcopenia, low muscle strength only. Confirmed sarcopenia, low strength plus low muscle mass. Severe sarcopenia, all 3 low strength, low mass, and poor function. 4. What are the common symptoms and risk factors? Here are the red flags to watch out for. Moving slower than usual, feeling weak, difficulty getting up from a chair or squatting, trouble climbing stairs without holding the rail, frequent falls or needing help to walk, losing weight, but mostly in muscle, not fat. Who's most at risk? People over 65, those with chronic diseases or poor nutrition, people who rarely exercise or are physically inactive, anyone who's had a history of falls, patients recovering from cancer, dialysis, or long hospital stays. 5. Is there any treatment for sarcopenia? Yes, the good news is sarcopenia can be improved or even reversed, especially if caught early. Current research supports a combination of the following. 1. Resistance exercise. Examples: lifting dumbbells, squats, resistance bands. Helps build strength, improve balance, and boost everyday movement should be done 2-3 times a week, consistently, long-term. Guidelines recommend starting slowly and increasing intensity over time. It's about building habits, not overtraining. 2. Nutritional support. Protein intake is KEY. You need at least 1.2 grams of protein per kilogram of body weight. A 60 kilograms adult should consume 72 grams of protein per day. Vitamin D also plays a big role in muscle synthesis. If needed, add milk with added amino acid supplements. Research shows that combining high protein intake with resistance training is more effective than either one alone. 3. Multidisciplinary care. Ideally involves a physiotherapist, dietitian, and doctor working together to create a custom treatment plan. 4. Other experimental therapies. Hormone therapy like testosterone. Still being studied. Possible side effects. Anti-inflammatory drugs and muscle-promoting agents not yet widely used in clinical practice. 6. What happens if sarcopenia is left untreated? If caught early and treated, many people can regain mobility and improve quality of life. But if ignored, muscle loss continues, leading to disability, bedridden status, hospital stays, and even death. Studies show that people with sarcopenia have a 1.5 to 3 times higher risk of dying than those without it. 7. How can we prevent sarcopenia? Don't wait until you're old. Prevention starts as early as your 40s or 50s. Here's how. Stay physically active every day. Walk, climb stairs, stretch, and do resistance training. Eat balanced meals with enough protein and calories. Get enough vitamin D from sunshine, fatty fish, or supplements. Research recommends 800 to 2,000 IU day for seniors. Works best when combined with protein intake. Avoids long periods of inactivity or bed rest. Get regular health checkups to monitor muscle changes. 8. Extra facts you should know. Around 10 to 20% of seniors worldwide have sarcopenia. It often occurs together with frailty and osteoporosis, making it even riskier. Countries like Japan, the US, and parts of Europe already have dedicated sarcopenia clinics. In Hong Kong, some public hospitals and community centers are starting to offer physical therapy and nutrition services for at-risk groups. Final thoughts. Sarcopenia is not an inevitable part of aging. But when it does happen and you don't deal with it, it can lead to serious, even fatal outcomes. The good news? It's treatable. It's preventable. With early screening, proper nutrition, and regular strength training, most people can slow down or even reverse sarcopenia. Let's protect ourselves and our loved ones. Let's stay strong, live healthy, and age with dignity.
Dr.BU 為你健康。
喜歡我哋嘅製作，點訂閱，點通知，Dr.BU 黃醫生一出片就會通知你㗎喇。多謝。
就算獨居，但有節目一堆，沒有藥水，沒腳痛，就有街去。夏季列隊，隊裏美麗不需換我汗水，沒計較，別太濕碎。磅數遞增，盡快鍛鍊身心。萬世巨星，萬世腳步也不震，絕世絕招，絕到把病把針。狂怒秘訣要不要？從你免費笑一笑，身心這健康，挫折我未放，每次也盛裝出賽。怪怪地方，似個壓力艙，進駐了太空一角。身心這健康，挫折我未放，困惱我一秒踢開。身邊有你愛我不錯，跌過我亦風光，當作紀念也不錯。 習慣夜深漸察覺視野不啱，步履認真動作拒絕分心，別太着急，自會告別這黑暗。入世未深未免怕人犧牲，集結大軍互勉發動解憂困，弱勢立身用愛破舊生生。有個勇氣我需要，愛嘅世界豁開了，深深寫健康，挫折我未放，每次也盛裝出賽，怪地方似個壓力艙，進駐了太空一角，深深寫健康，挫折我未放，憤怒我一秒踢開，身邊有你愛我不錯，跌過我亦風光，當作紀念也不錯，多得有你愛我一個，跌過我亦風光，當作紀念也不錯，真的也不錯，也不錯。Dr.BU 為你健康。
喜歡我哋嘅製作，點訂閱，點通知，Dr.BU 黃醫生一出片就會通知你㗎喇，多謝。
就算獨居，但有節目一堆，沒有藥水，沒腳痛，就有街去。夏季列隊，隊裏美麗不需換我汗水，沒計較，別太濕碎。磅數遞增，盡快鍛鍊身心。萬世巨星，萬世腳步也不震，絕世絕招，絕到不病不侵。狂怒秘訣要不要？從你免費笑一笑，身心寫健康，挫折我未放，每次也盛裝出賽，怪地方似個壓力艙，進駐了太空一角，身心寫健康，挫折我未放，困惱我一秒踢開，身邊有你愛我不錯，跌過我亦風光，當作紀念也不錯。沒有路燈，靜聽百面聲音，習慣夜深漸察覺視野不啱，步履認真動作拒絕分心，別太着急，自會告別這黑暗。入世未深未免怕人犧牲，集結大軍互勉發動解憂困，弱勢立身用愛破舊生生。有個勇氣我需要，愛嘅世界豁開了，深深寫健康，挫折我未放，每次也盛裝出賽，怪地方似個壓力艙，進駐了太空一角，深深寫健康，挫折我未放，憤怒我一秒踢開，身邊有你愛我不錯，跌過我亦風光，當作紀念也不錯，多得有你愛